Okay, I think we can get going. So, welcome everyone. Good morning, good afternoon, good evening, wherever you are across the world, whether you're joining us live or joining us when you're watching the recording, which I know a lot of you will do afterwards. This is the second of 3 sessions that we're running alongside our Global Solutions Initiative, which we are delighted to say we are partnering and collaborating and working together with Sabin Vaccines again, which has been a very successful partnership and venture with us previously, very well established with significant impact and opportunities for members of the Nursing Now Challenge over the years. Incredible. Just off the top of my head, I'm thinking of Amy Staley, who was a vaccine champion and has just attended her 3rd UN General Assembly in New York. And the Sabin Vaccine Initiative with us was really the catalyst for her, really to be operating in that area at such a high level. And she has gone on and continues to do amazing things. And there are many others. So hopefully we will see more of that with this particular initiative. Hopefully it's not the last. And thank you today for taking the time. Marissa is with us, who will be taking us through the session, and luckily enough, we have a number of other colleagues with us today who will speak about their experience, and then we'll hear from Sana at the end just with concluding remarks and other information. Please use the chat to introduce yourself. Let us know where you are based. I can see some familiar names and some new names, perhaps. I can see Sandra Pennis, who I know is joining us from Canada. Hi, Sandra. And interestingly enough, Sandra, I know you're doing a lot of work in Ghana, and we have Rukaya, who's a registered nurse from Ghana, who's presenting. So that's wonderful. Great connection there. And I can also see Abigail Weavers, another Canadian. So it's funny how we see different people coming from different places. Anyway, enjoy this afternoon, and I can't wait to hear more about this and hear from Marissa and the experiences from the field. And hopefully you'll share this with your colleagues, encourage them to take part and apply and consider this. We as nurses always talk about change happening, and why is change not happening? The people who will make the change is us. And this is an opportunity for us to create a significant impact for women across the world and their children and wider communities. So I'm going to pass over with great thanks and pleasure to Marissa, and enjoy the next hour. Thank you so much.
Thank you so much, Aisha. I will go ahead and share my screen and we can get started. So if this is your first session with us, I am going to reintroduce myself. So my name is Marissa Malchione, and I work with the Sabin Vaccine Institute. And we're so excited to be partnering with the Nursing Now Challenge and the Global Solutions Initiative for this session and for this series, really, on HPV and cervical cancer. So if you didn't join us last time, I'm going to just start with a very brief recap on what we covered in session 1, and also encourage you to check out the recording from last time as well for a more in-depth dive into that discussion. But I am part of the Global HPV Consortium. The Sabin Vaccine Institute serves as the secretariat, and we are a movement to prevent HPV, human papillomavirus infection, and drive action towards the elimination of cervical cancer as a public health concern. So we talked last time about the global impact of cervical cancer, where over 600,000 women are diagnosed with cervical cancer every year, and 350,000 women die from that disease. Unfortunately, those numbers of new cases of cervical cancer are continuing to rise. So last time we looked at those numbers and the impact by region, and we saw that Africa, Latin America, and Asia have the highest rates of both new cases over here in orange and deaths over here in the reddish color. And so we discussed that there are these inequities that clearly exist, making the burden of cervical cancer worse in certain regions than others. We also pointed out that the incidence rate, or the number of new cases over here in orange, is 4 times higher in Africa compared to North America. And the mortality rate, or women who die from the disease, is 8 times higher. So this once again points out that a higher rate of women who are not screened or treated early enough to save their lives. So the World Health Organization has declared that in order to eliminate cervical cancer, all countries must provide services across each of these 3 pillars, and they've designated corresponding targets for each of them. So we have vaccination, screening, and early treatment. And so I will give a high-level overview today of each of those 3 pillars or mechanisms for cervical cancer prevention that can lead to elimination. So first we'll start with the HPV vaccine. So the vaccine is given to adolescents and it protects against certain strains of HPV and the diseases that this virus is associated with. So there are a number of cancers that that HPV, that human papillomavirus, can cause, including cervical, vaginal, vulvar, anal, head and neck cancers, and genital warts. So it's most effective if the vaccine is given before exposure to the virus, and that exposure typically occurs with sexual activity. There are also different types of HPV vaccines that contain a different number of HPV strains that they offer protection against. However, all of the vaccines offer protection from HPV strains 16 and 18 because those are the most high-risk strains and most associated with the development of cancers. So I didn't progress my slide here, but just to reiterate, HPV 16 and 18 are the high-risk cancer strains, and they are associated with the development of cervical and other cancers. So who is eligible to get the vaccine? So this will vary from country to country based on their policies, but typically we say adolescent girls aged 9 to 14. In some countries, males have also been added to the eligibility list because males are carriers of HPV, of the virus, and are susceptible to some of the cancers that it causes. So in some countries, they have introduced HPV vaccination for adolescent boys as well. Another question we often see is how many doses, and this can vary too from country to country based on policies. 2 doses is typically recommended, separated by a period of weeks or months, though many countries have introduced a single dose approach, meaning that 1 dose is required for full protection among healthy adolescents. Now, high-risk individuals, such as those living with HIV or those at high risk of HIV, those with other that are immunocompromised for other reasons, should receive 3 doses of the vaccine, separated by a period of weeks or months. Another common question is, are there any side effects to the vaccine? And there are mild side effects, much like you would see or experience associated with other vaccinations. So pain, redness or swelling at the injection site, mild fever, headache or tiredness, and slight muscle or joint pain. So next we're going to transition into that second pillar for screening. Now there are also different types of screening mechanisms offered to women. Generally, women are screened to either identify the presence of HPV or to identify cellular changes in the cervix that indicate early cancer, so that they can be connected to the appropriate management or treatment before development of full cervical or other cancers. So full cervical cancer requires more intensive and invasive treatments. It's harder to access in many LMICs, low and middle income countries, but it can also leave quite a lasting impact on women's quality of life moving forward. Because of that, it is so critical to identify the presence of HPV or those minor changes to the cervical cells early by using screening mechanisms, because these early detection and screening opportunities and management for those early changes at the cellular level can be managed much more easily. They have a quick recovery rate, and we'll talk about those a little more in depth coming up. Now, we wanted to give a few examples of common screening methods, and these vary depending on region and geography. But just to give a high-level overview, HPV DNA screening identifies the presence of high-risk HPV strains that could go on to lead to cancer. This is conducted by a healthcare provider who typically uses a brush to scrape cells from the cervix. They're sent to the lab and they're examined for the presence of HPV DNA. This is performed at a health center or clinic, or also can be done at home with self-swabbing. Self-swabbing can also be done at a clinic. So there are a few different options there. And this is the one that WHO indicates as sort of that high performance screening test that can lead to elimination of cervical cancer. Other regions focus on visual inspection with acetic acid, or VIA, and that requires trained health professionals to apply 3% to 5% acetic acid solution to the cervix. They observe the cervix for 1 to 2 minutes, and they see the reaction of the cervix, and that can determine a positive or negative result. That is always performed at a health center or clinic. And then lastly, the PAP test, which is also a healthcare provider conducted test where there's a small brush and a spatula that gently scrapes cells from the cervix. Those cells are sent to a lab to be examined under a microscope, and they can evaluate the level of change or dysplasia of the cells. So a little bit more about 2 of those here. But yes, these are the 3 you'll most typically see and may have either experienced or conducted yourself. So again, who is eligible? And WHO recommends that women get screened for cervical cancer every 5 to 10 years, beginning at age 30. And they also recommend that women living with HIV get screened every 3 years, starting at age 25. And now finally for our last pillar, management and early treatment. So as we said, it's so important for women to get screened, because if they are screened positive, they must be connected to the appropriate management or treatment services. So a positive screening result can either be the presence of high-risk HPV DNA, such as strain 16 or 18. It can be a positive VIA test, or it can be where the PAP test shows abnormal cells. So you can see some of that here of what that dysplasia starts to look like as you progress from low levels to high levels to cervical cancer, and what they might see in a pathology. So first, there would be a need to, after testing and testing positive, you would be referred to a colposcopy, which can help to further evaluate the cervix for abnormalities. It may involve a biopsy, and then that can more appropriately refer the patient to next steps. And then our last slide on this is just a few examples of common methods used for early treatment. So cryotherapy uses ultra low level temperatures to dehydrate cells. Thermal ablation, which is probably the most commonly used in low and middle income countries, uses heat through a metal probe to dehydrate the tissues. Both are typically performed without anesthesia. They do cause some mild discomfort, but again, overall short recovery time and much lower intensiveness and a lower invasiveness compared to waiting until that cancer has progressed to full cancer. Here are some others used, like laser ablation, radiofrequency ablation. So there are a few other options used, but these 2 are what you'll most likely see in many regions around the world. So now that we've covered the types of preventive services, what is the role that nurses can play? So obviously, besides the delivery of those services themselves, nurses play a critical role in building trust around those services, educating patients or parents around the importance of preventing HPV infection, educating women about the importance of screening, answering questions that dispel myths and rumors, and sharing your knowledge with other health workers to expand this group of champions for vaccination, screening, and treatment. So through the Nursing Now Challenge Global Solutions Initiative, there's this opportunity to contribute beyond those areas I just named and create sort of new and innovative ways to decrease the barriers to access and improve the acceptance and demand for these services. So the challenge question for this series is create a concept note that crafts a solution to increase the access, acceptance, or uptake of HPV and cervical cancer prevention services. So that could be for vaccination, screening, or treatment, or across the three of them among adolescents and women in your community. So we wanted to give you a few examples of the types of issues here and what could be addressed in your concept note. So these are also listed in the guidance document that I think the Nursing Now team has shared or can probably share again if you're new to this session. So just quickly, what some of this could look like. It could be around overcoming the existing social, logistical, or financial barriers that women and adolescents face when they're seeking HPV vaccination or cervical cancer screening and treatment. It could be about improving accessibility among difficult to reach or remote communities. So especially those from minority or migrant populations, adolescents who are out of school, since most HPV vaccines, depending on the country, but many times they are delivered through school-based programs. Integrating the HPV vaccine and cervical cancer treatment services into existing health or non-health services. So that could be maternal, newborn, child health. It could be HIV/AIDS services. It could be nutrition or mental health services, just to name a few. Improving the connection to management and treatment services. So we often see a loss to follow-up that happens for women who screen positive for pre-cancer lesions. So how can we better connect them to management and treatment services? Dispelling myths and rumors is a big one, and it's pervasive in some communities in some regions around HPV vaccines and cervical cancer screening and treatment. So dispelling those can increase the acceptance and uptake among patients. There's shown success in achieving this multi-generational approach to cervical cancer prevention. So capturing that education and awareness for adolescents to get vaccinated and integrating that into screening and treatment for older family members like mothers or grandmothers. Also educating parents and community and religious leaders around the importance of preventing HPV and cervical cancer through vaccination, screening, and early treatment. Now, I wanted to note that HPV vaccination has not been introduced into the national immunization program in all countries. So if you are from a country where HPV vaccines are not available in the public health system, you have a couple of options. You could either focus on improving the access and uptake of screening and treatment, of course, of those secondary prevention services, or develop a strategy that would prepare communities for the introduction and availability of the HPV vaccine so that when it does become available, the community is excited to receive it and adolescents do end up going to get vaccinated. So I want to encourage everyone to check out the Facebook group where I've shared a number of resources that can help inform your submissions. There are a few different data sets that you can look at your country-specific data to get a better sense of what is currently available, what are some of the challenges, and how can your concept note address some of those challenges. So the winner of the challenge will be selected and invited to attend the Global HPV Consortium Partners meeting in February of 2025, where they will present and receive feedback on their innovative ideas from a really wonderful transdisciplinary group of global, regional, and country-based experts. I didn't have that slide in this presentation, but you'll see from last week's presentation that we have over 55 partners of the consortium. They represent across all regions of the world, and they also are across sectors. And so a recording of that solution presented by the winner will be featured on Sabin and Nursing Now Challenge's YouTube page as well, and also promoted on social media. So it's not just the presentation, it's also an ability to have this resource that you can continue to use and promote around your wonderful ideas. And I think that is my last slide. So that's it from me. Happy to answer any questions in the chat, but I will turn it back over to the Nursing Now team to continue on our agenda.
Thank you so much, Marissa. It never ceases to amaze me listening to the data that you share with us in the slides, and to think that this is still an issue for us globally, and the impact that it has, the negative impact that it has, despite us having a solution. And I'm so glad we're able to do this. The work that you're doing through your global consortium is amazing. It's a real example of the way we need to work moving forward, building coalitions, building networks, bringing the key actors and stakeholders together. And those of you who know me will know I love the work of Jeremy Schiffman, and Marissa probably will know Jeremy and his work, where he tries to help us understand why certain things become global priorities health-wise and some don't. And I was teaching this in class last week or the week before with colleagues who were coming from different backgrounds, not just nursing, and trying to help them with the technical elements of this, because there is a strategy to this that we can engage with and utilize. Some of it definitely is relevant in terms of the political climate, etc., that can impact, and conflict, etc. But we have to maximize and optimize what we have at our fingertips. And it is significant, the workforce, and nursing, as we are the largest workforce reaching all corners, have a really important part to play. And I think we showed that we do have that important role, and we can embrace it. And our early career nurses are involved. I think we improve our chances of making an even greater difference. So thank you so much, Marissa. I think the most important thing, though, is to hear from those who are actually doing it. They're the ones. I can say all the things I want to say, but as always, we want to hear from our wonderful guests who have taken the time away from their busy day jobs, and are able to share with us their experiences. So we are first going to move, and we've got this experiences from the field, to Rita, who is from Lebanon. And Rita, just to say, we are very much thoughtful of you and our colleagues and everyone in Lebanon at the moment, as we are across the globe, where people are suffering and managing conflict. So Rita, take it away, and then we will, after Rita, hear from Rukaya in Ghana. Thank you so much, Rita.
Thank you so much. I'm Rita EA, a registered nurse from Lebanon, and I'm also a champion of Nursing Now Challenge. I'm so proud to share with you my humble story with HPV vaccine advocacy in Lebanon. So growing up in a country that is so beautiful like Lebanon is going through cycle periodic wars that is not just devastating buildings and killing people, but also going to re-emerging vaccine-preventable diseases such as polio and other diseases. So, as healthcare professional, during my career, I've seen the impact of those vaccine-preventable diseases that are causing death and lots of damage to people. I grew in a family seeing my own brother living with polio because we were born during the civil war. Also, getting my career as nurse during the second Lebanese war, I lose my mentor due to cervical cancer. So all these impacted highly my values and I trust that we have something to do. Recently, during the COVID, I had the opportunity to join Nursing Now Challenge, Sabin Vaccine Institute, and Boost Community. And I had an amazing learning journey with them that led me to have more leadership skills and understand that we are the actors of the change that we want. So, in this perspective, I think that we can do something even if we are in a low country of incomes, in a country that is hit every day with wars, because HPV is a disease that we can prevent with vaccine, and also cancers that are related to this disease are preventable. In Lebanon, the situation is that HPV caused one of the top 10 cancers for women that are aged from 15 to 44 years. And 2.5 of the Lebanese women, at some day, they will have HPV-related disease type 16 or 18. And 72% of Lebanese women will have invasive cervical cancer that are related to type 16 and 18. And just few minutes before me, we heard that those are preventable with vaccine. And the women can be dead 60% as a rate. Can you imagine? The mothers, the women, the young are dead because of a vaccine-preventable disease. And unfortunately, in Lebanon, if we look to the data, it's very hard to find studies. And also, we do not have HPV planning for the vaccination. There is no national program. Even the physicians doesn't talk about this disease and this HPV. Also, we have in Lebanon some firms that are introducing 2 types of HPV vaccine. But unfortunately, we have lots of barriers. What are those barriers? First, there is lack of awareness. The population in Lebanon doesn't speak about HPV as a disease. As healthcare, we do not have this disease in our curriculum, in our universities. Even as a pediatric nurse, I've worked as a pediatric nurse, we do not have this in our daily thoughts. Also, there is another barrier that is the cost. It's highly cost in Lebanon. If you imagine that for a family, a father can earn $400 per month, each vaccine dose is $100. So, of course, it's not a priority for the family. Also, we have the cultural, the religious beliefs about this disease. I'm not concerned. I will not have this disease. I'm not exposed. I don't know about HPV. So, really, there is no awareness. Only in one study in Lebanon, I found that we have only 16% of female age between 17 and 30 years that had one shot of this HPV vaccine, but it is very concerned in a small community in one university, so this is not so reliable. Lack of data, lack of studies. So seeing all this and believing that we can do something to change, I thought, can I, as a nurse, do something? Of course. Even if I am a nurse and one voice, I can do something. And what I did is that on the International Health Day on 7 April 2023, I get to my school, local school, in my very lovely village in my country, Lebanon, and I took the initiative to raise my voice and to speak about HPV and vaccination in this local school. It wasn't so easy. It's really a very distinguished community. It's not something that we do every day and we speak about every day, but empowered by the learning and the leadership skills that I gained over the learning over the past 5 years, I decided to do a move, to do something, to do a change. So with my baggage of this learning, I spoke to teenagers and I get to have in one room 60 teenagers. I raised my voice I spoke to them about HPV and the cervical cancer and other cancers caused by HPV, how they can be infected, and also how the most important can be protected by a simple vaccine. And what was really overwhelming and amazing is the reaction of those teenagers that were really, really very interested to know about and to be positively responding to the call to action, and they decided they are committed to also share this learning, go to their families, speak to their peers, get involved in this work that One Voice was doing, and now we are more and more growing as a community of telling about the importance of getting vaccinated. They went to their families, they spoke about this, they asked about it as a Christmas gift because it's highly cost. So yes, let's have this as Christmas gift. And I know that they did it because when I go on Sunday to the church, I meet their parents and they are like, what are you doing? About what are you talking? And like this, one by one, we are raising awareness. Of course, it's one small step, very humble story that I'm sharing. But I believe that we have to educate, we have to empower the younger generation, we have to support, to engage our community with us, not just to have the knowledge for us, to share and even to celebrate small success, because like this, we can build a more big constituency, we can speak the same language, and right now, we are advocating for a national HPV vaccination program. Despite the wars that is going on in Lebanon, there is lots of people that are displaced, but also in the second hand, there is lots of NGOs that are here. So if us as a nurses are getting to the shelters where people are placed, and while we are talking about hygiene, about prevention, we are also talking about vaccine preventable diseases, and we are talking about HPV. So like this, we are raising awareness, and we are also bringing some political decision to the table with our voices and with our engagement. Thank you. And I'm happy to answer any question in the chat. And thank you for this opportunity to share.
Wonderful. I mean, I'm sort of speechless listening to that, and it's just amazing. I can't tell you, it's just amazing and quite emotional, I think, listening to the reality of your story and how, despite the challenges, the reasons for most of us not doing something, you have, in the best way, forged a path and found a way and are doing it. I mean, it's just absolutely wonderful. I mean, people are putting in the chat here, incredible, inspiring, you're doing a great job, great effort. Even through dark days, Lebanon always shines. Thank you, Rita, for this spectacular session. I mean, it's just wonderful, inspiring, fantastic work, so impactful. I mean, this is it, Rita. Please never stop. And I mean, we're going to move on to our next speaker, but it is phenomenal, and your work, and you have to be elevated. We need to spread the word. We need to let people know this is what nurses are doing. We're doing it, and how impactful that is being and is happening, and it's real. It's great. I think we need to stop believing and enabling the containment that society puts on us. And we just need to get things done, as the wonderful Peter Singer says. Okay, so we maybe have some other questions coming, but pop them in the chat, or we can do them in the end. We've got a Q&A at the end if we've got time. So we are now moving to our next wonderful speaker, Rukaya, who's a registered nurse in Ghana, and delighted to meet you, Rukaya. And I'm just going to move straight to, if you can tell us a little bit about yourself, and if you can tell us your experiences, I'm sure they will be as inspiring. Thank you so much.
Hello, thank you so much for this opportunity. My name is Rukaya Mumuni. I'm a registered nurse and a public health officer in Ghana. And I'm also an immunization advocacy champion for 2022 with Nursing Now and Saving Vaccine Institute. So my experience with cervical cancer started in 2019 when I realized that in the hospital that I work is within Greater Accra. It's a district hospital. And there was no screening services for women, screening services for cervical cancer for women in this particular district. This hospital, it serves a lot of people. We have a lot of communities under this hospital. And what was even worrying was that it is in the urban center, because Accra is a urban town, and we are expected to have a lot of services for women in such settlement. But there was no screening for women. Nobody was talking about cervical cancer. And from my learnings and then my exposure to data, I realized that cervical cancer deaths was very high in Ghana. Women were diagnosed as of 2022, we had about 3,000 women diagnosed with cervical cancer, and about 1,800 are dying because of cervical cancer. So I had to ask, and then I was told that then there was a nurse that was screening, and this nurse was also transferred to a different hospital, and because of that, our hospital was not screening for cervical cancer. So I engaged the hospital management, and they were able to train some nurses, some midwives, about 4 midwives to start screening. So the hospital actually started screening in 2021 for cervical cancer, a big hospital in Accra, you can imagine. And when I talk about these things, what comes to my mind is about those in underserved community. If a district in Greater Accra is not providing, or several facilities in Accra is not providing cervical cancer screening, what about those living in deprived communities where access to healthcare is very limited? And it raised a lot of questions. So this is a very big issue that we are dealing with, because cervical cancer mortalities or death rates related to cervical cancer keeps increasing every year, and we have to do something about it. And my engagement in advocacy, because I was able to even go to international platform to advocate for cervical cancer access vaccination at Rwanda, when I was nominated by Saving Vaccine Institute to attend the Women Deliver Conference in Rwanda. And due to the work that I was doing in Ghana related to cervical cancer, I was also nominated to receive an award of Hero of Health for Ghana. And this was an incredible moment for me, because it was my first time of attending an international forum, and at the same time receiving an international recognized award as a grassroots or a health worker that is coming from working for deprived communities. So it was so empowering. And I'm going to stand here and say that this is the opportunity. There are other nurses that are on the call should take this initiative or this challenge very seriously, because this is the opportunity for you to be heard, for you to tell your story, for you to let people know what you are doing to improve healthcare delivery in your various localities or in your various countries. I was able to undergo a lot of skills, leadership skills training, like skills in storytelling, public speaking, and advocacy. And this has empowered me to be able to speak or to be able to advocate for women in Ghana and beyond. And most importantly, cervical cancer. I have become a face of cervical cancer in Ghana because of my exposure to Sabin and then Nursing Now initiatives. So what is happening in Ghana is has to do a lot with low awareness and then low screening rate. Like my sister from Lebanon, Rita, has mentioned, we face similar issues in Ghana. We don't have the resources for screening. We don't have resources for vaccination. Actually, Ghana took part in the trial when they were trying the vaccine for rollout. Ghana took part, I think, around 2014. But rolling out the vaccination in the national immunization campaign has not been done yet, and it is an issue that we need to discuss. So it's part of the work that we do to be able to ensure that vaccination is rolled out in Ghana. We educate people, we create awareness in communities, and as part of my work, I have been able to do a lot of engagement with communities, schools, where I educate school young girls on HPV vaccination and then HPV infections and how to prevent themselves from getting an HPV infection, and as well as increasing awareness in communities to be able to ensure that women are able to come and screen for cervical cancer in the various facilities. But these screening services are still inadequate. We still have a lot of communities that are not able to access screening within their community. They have to travel long distance because it's only one hospital. For instance, the district that I am coming from is only one hospital that provides screening for cervical cancer. And these are the issues that we still have to deal with when it comes to cervical cancer screening and then vaccination in Ghana. So what I want to say finally is the need for us to scale up. We need to be able to get Ghana or other countries, especially lower and middle income, more countries to be able to roll out the HPV vaccination in order to prevent young girls from getting infected with the HPV virus earlier in life before they get to sexual active age. And this has been something that I am championing, and I'll keep championing, and I encourage all other nurses to champion HPV and then cervical cancer awareness and screening in their various locality. I will just want to acknowledge the work of Nursing Now and Stable Vaccine Institute for the empowerment and then the skills that they equip nurses with to be able to champion healthcare, especially when it comes to vaccination and then cervical cancer in our various settings or in our various countries. It is a big initiative, and it's a very good way to be able to ensure that we nurses at the lower level are able to impact the health of our people in our various countries. Thank you so much.
Hiya, wow. Also, I mean, I think what I've moved from being a bit emotional and a bit speechless to feeling hugely positive after having listened to these two stories. Positive because you're an example of, luckily enough, many, many nurses and midwives across the world who are doing this. And I think we have to also start changing the narrative that we need more people doing this. We do, however, we already have nurses and midwives doing it. So let's shout about that. Let's have that voice raised of those of you who are currently doing it. We're not at the very beginning. We are much further on. And even over in the last several years, the opportunities working with Sabin around vaccines and the development I've seen of our early career nurses and what they're doing, it's phenomenal. So we are on a journey and it is growing. it is not stopping now, and we have to keep going with it. Absolutely fantastic insight there around Ghana. And I think that picture helps us understand why, despite having the answer and the solution, we are challenged, like many other areas, in relation to the geopolitical context, the attitudes and cultures, the existing systems that are there, the capacity. There are lots of more technical, nuanced societal issues that require our attention. And what is really interesting is, as nurses, we deal with that every day. That is our job. We are absolutely able to deal with very complex situations, and we do it naturally. Midwives also. So we are absolutely the people that need to be involved here at the forefront, forging things forward. Again, we've got some wonderful comments in the chat there coming in, and I'm so glad actually that Buki, who is from Nigeria, I left you a message, but actually, the person I was telling you about to connect you with is Aramoki, who's also from Nigeria and is very interested in things that you're interested in HPV. So you see each other and we can connect you both. And this is what we need to do, start connecting everyone together. So any questions? I'm just looking at the time. We've got 13 minutes, so we are a little bit tight for time. But if there are any questions, let's take them and let's hear from you before we go to Marissa. Anything? Oh, here we go. We've got a question. So what about boys, men, access to the vaccine in Ghana? Is there a policy on that? That's an excellent question. I could answer it for Scotland because there is, and my children, I have 3 sons, and they are all vaccinated. So there we go. But let's find out from Rukaya what is happening in Ghana.
Yes. So for now, the HPV vaccination hasn't started in Ghana, and we are looking at girls because of the risks that they pose when it comes to HPV infections. So for the meantime, maybe the policy is going to focus on only girls, even though we don't have one yet. And I know a lot of countries having started. Nigeria have started vaccination, but not for including boys. And it's going to be a gradual process. And maybe with time, if we are able to cover a lot of girls, more boys too will get involved. But for policy, I am not aware about any policy that involves boys in HPV vaccination. Thank you.
Yes, yes, yes. And I mean, I'm not an expert in this field per se, but I do find it interesting when, because of probably, and Marissa may be able to comment on this in her bit, but it concerns me when this is seen as a women's issue, and it absolutely is not. And I think that's one of the things. This is another thing that is for women only. And when that happens, we are sidelined and we are not a priority. So I'd love to hear from Marissa. Any more questions? And then we'll maybe just head straight over there. I know Sandra's put in the chat. She works in the Savannah region of Ghana and is doing some work around hypertension there. Some similar challenges and issues in terms of reach, etc., rural communities and things. So hopefully you two will be able to connect. We can do that. Marissa, the last 5 minutes are over to you. You know, this mini challenge that we're setting up, is there anything else people need to know? What are your thoughts from what you've heard? And if you can just give us kind of a little summary before we close.
Absolutely.
Anna. Yeah,
Well, first, Thank you so much to Rita and Rukaya for sharing their experiences. Aisha, as you said, that is the most important part of these sessions, is to really learn from and hear from the lived experiences, and reflect on how that resonates with each of you and each of your experiences. So thank you for the inspiring talks from both of our speakers. So yes, first let me share our mini challenge. So a mini challenge is basically something that we post on the Facebook group for the Nursing Now Challenge, and I'll go ahead and share my screen one moment as I get that set up. But after each session, we post the mini challenge on the Facebook page, and we ask that those that joined comment below in the post and share a response to the question. So for the second mini challenge, we want you to share your ideas about how to tackle misinformation, myths, or misconceptions around the HPV vaccine. So this could be something that you're thinking about writing for your concept note. This could be something that you've seen in action in your communities that's worked really well. This could be something that you've heard about and would like to see implemented in your own communities. So that is our mini challenge for today. And we would love to see you, like I said, post your responses in the Facebook group. After we log off here, I'll have this picture up there with the challenge, and you can comment below. This will lead into the next session, which will actually talk about a lot of the strategies for promoting acceptance and uptake of the vaccines, including how to dispel that misinformation, myths, and misconceptions. So if you give us a response here in the Facebook group, we might be able to profile it or dig deeper into it a little bit more in our next session. So before I log off, I want to share one other thing, which is something I mentioned also in the Facebook group. And I will go share my screen again. But what's really critical to informing some of these concept notes are some of the data points, so that you understand, what is available in each of your contexts. And so I posted first, and this is from the View Hub at the Johns Hopkins University. This is a map, an interactive map, that you can click on a country of interest, and you can show what information is available around the availability of the HPV vaccine. So we were talking about Ghana before, so I went and clicked on Ghana, and it shows that there is approval with clarification, and that, as Rukaya said, that they are in the process of making those decisions. For another country like South Africa, let's say, it has a bit more information. So it'll tell you that it was introduced into the National Immunization Program, when was that introduction, and what type of program is it, what type of vaccine. As we talked about earlier, there are different types of vaccines. So this one is HPV-2, which means that it has a bivalent of both 16 and 18. It tells you what the recommended dosing schedule is. So this is 2 doses. They deliver them via schools, and the target population is female, and when this was all last updated. And you can click here to get more information on the country profile. So I definitely encourage you to click around and see what your country or other countries are doing, and what the status of introduction is. So that's for vaccination. Next, I'll go over to screening, and we shared this resource as well called CAN Screen 5 from WHO's International Agency for Research on Cancer. And you'll see that there are different country fact sheets that are across each of the regions. Not all countries have a fact sheet for cervical cancer at this point, but if you are interested, just click around, and there is still some information there. So we'll just click on, let's say, Zimbabwe. And so first you'll have the country tab show just general country information. You'll see then you can click over to cervical, and it'll tell you all about the screening program, when it was initiated, and some of the other individual points about it. For example, here the treatment modality is thermal ablation and cryotherapy, which we talked about. And so it'll give you just a little bit of information so that can help inform your concept notes. So I just wanted to profile that those resources are available in the Facebook group as well if you scroll through, and we can continue to add more as well. But yes, it's been such a pleasure to be here, present today about the 3 different mechanisms for prevention for cervical cancer and HPV. And yes, I will hand it back over to the Nursing Now team to close us out.
Lovely. Thank you so much, Marissa, and great resources that are suitable assets for us. I am now going to introduce Sana, who will close us out today and give us her closing remarks and thoughts. Over to you, Sana.
Hey, hi everybody. Thank you so much, Aisha. I didn't know I need to present the closing remarks though, but I would love to. I'm very inspired by Rita Rukaya, and thank you so much. And we are privileged really to have you in our team. I'm sure many young nurses would learn from you guys, and you just show the work nurses and midwives are doing in the community and why we need to spotlight you guys, because we are doing the real work and we need to be need to tell the world the work we are doing, and we need more support and investment. And thank you so much everybody who joined today, and this is an amazing challenge. And you have all the resources. Thank you, Marissa, for sharing all these amazing resources that you have, the data where we get the Facebook group. Everyone, I would highly encourage you to join the Challengers Committee Global Solutions Facebook group, which has our Nursing Now team, Hannah and Fi, are updating every minute, where you can find the resources and meeting links and next sessions. And we have been doing this for quite a while, and there has been such amazing ideas on different topics that the nurses got the funding, got the support, got the platform to showcase their work. And this is one of them. And I'm sure you all have amazing ideas from around the globe with different challenges, but you know how the work to be done. So this is the place where you can get the support and opportunity, the platform to showcase your ideas. So go for it. Share with your colleagues, share with your young nurses around you, in the universities, in the hospital. Get the team sorted, everyone together, put on your ideas. And thank you so much for attending today. Thank you, Aisha.
Wonderful. Thank you. Bye, everyone. Thanks so much, Sana. Wonderful job.